Our case study for viral hepatitis is about a 52-year-old white male with no significant past medical history other than laparoscopic cholecystectomy. Now he's presenting with only fatigue and weakness for 3 weeks. Well, this might not be very kind of specific for hepatitis. But in the social history, there is a significant history for intravenous drug use, significant history of intravenous drug use. And the patient has slightly elevated liver enzymes. And serology testing revealed positive IgG and positive IgG anti-hepatitis C antibody. Now you find the antibody against hepatitis C virus. Of course, you cannot form an antibody against hepatitis C without having hepatitis C virus in your body. And the patient also tested positive for hepatitis C virus RNA, 2.7 million copies per milliliter, and the liver biopsy showed findings consistent with chronic hepatitis. Now this patient, what is an appropriate diagnosis for the patient's condition? It is going to be chronic hepatitis C. Which 3 tests are most definitive in determining this diagnosis? Liver biopsy, the serological tests, when you find the immunoglobulin G anti-hepatitis, and when you find the positive hepatitis C virus RNA, all these are diagnostic for chronic hepatitis C infection. Identify this patient's potential risk factors for viral hepatitis. What are the risk factors for viral hepatitis in this patient? Significant history of intravenous drug use, because hepatitis C and hepatitis B are transmitted by the blood, History of self-administering cocaine intranasally, 5 large tattoos, and previous blood transfusion. All these are risk factors for viral hepatitis. What is the most likely cause of this patient's viral hepatitis? Well, the most likely cause is going to be what? The intravenous drug use. Question 13 asks about the abnormal lab tests that are consistent with the diagnosis of liver injury and reduced hepatic function in this patient. We have elevated liver enzymes, AST and ALT. Of course, because it is a viral hepatitis, we expect more increases in the ALT. We have elevated alkaline phosphatase and elevated total bilirubin and elevated conjugated bilirubin, slightly subnormal albumin. This might point to some defect in the liver function, and slightly abnormal total protein concentration. Question 14. What's the single most significant abnormal finding in the patient's urine, and why is it consistent with the patient's condition? Well, the single most important finding in the patient urine is the presence of bilirubin. What type of bilirubin do you expect to see in urine? Either the indirect bilirubin or the direct bilirubin. If you said direct bilirubin, you're absolutely correct. Indirect bilirubin cannot be found in urine. Why? Because indirect bilirubin is water insoluble. You cannot find in urine whatever is water insoluble. So with viral hepatitis, the bile canaliculi are kind of edematous and injured, and the bile flow is obstructed, so we get elevated levels of conjugated or direct bilirubin in the liver, and this will accumulate in the blood, and this will show up in urine.